My name is Dr. Katie Peters, and I'm a physician at the Preston Robert Tisch Brain Tumor Center. The reason why patients should come to Duke for brain tumor treatment is we really are at the cutting edge. We sort of sit in the translational world of medicine, where we have top-notch scientists that are studying how these tumors develop, how they grow, and then we have top-notch clinicians that are actually figuring how to cure these tumors. And we are very hopeful that someday we will have a cure, so that's why patients should come here. I'm from a really small town in Tennessee. I'm from rural Tennessee. I went to a public high school, and you sort of really had to find science there. And the way that I did it is I went to my little local science fair, and then I was very lucky and I got to compete at the Tennessee level. And really enjoyed it and loved making up experiments. Then I was very lucky. I got a scholarship to go to college at Emory University, and I knew I wanted to be a scientist. And I was a biology and chemistry major, and I really loved both of those sciences. But what sort of struck me is the way the professors would always come back to how is it important for the disease process. And I became very interested in cancer and how the cancer can develop, and how can we detect cancer in patients before they have any symptoms. Because the whole idea, and it seemed to make sense to me, if we could find it faster before it hurt anyone, well, maybe we can fix it better. So that was just sort of I guess that was my idea as a college student. During neuroanatomy, which is where we learn about the brain and the function of the brain, I sort of fell in love with it. I fell in love with how the brain could tell you to, move your right arm, or to move your left leg, or to talk, or to recognize faces, or to sing, or to play a musical instrument, or to have a certain quirk in your personality. And it seemed very human and far away from the little culture dish of cells, the cancer cells that I was studying. So as soon as I took that course, I knew I was going to be a neuro-oncologist.